Hi everyone, I'm Dr. Shiva Araya. Today we're going to be talking about hay fever with immunologist Dr. Jessie Lee, who works with me at Holdsworth House Medical Practice in Sydney. Thank you for joining me in the video today, Jessie.
Thanks for having me, Shiva.
Can you describe to us what hay fever is?
Sure. So hay fever, or allergic rhinitis, happens when a person breathes in an airborne allergen, such as pollen, dust mite, animal dander. So definitely not just pollen and not just hay. And this results in an abnormal allergic response where the body doesn't realize that these things are harmless. And what happens is that chemicals such as histamine are released, which results in itchy and watery eyes, runny nose, sneezing, and other chemicals that can either act on the airways directly or recruit other cells that cause inflammation.
Right.
And this causes swelling of the airways, sinus blockage, nasal blockage, and in its most severe form it can result in headaches, difficulty sleeping, poor concentration, poor work and school performances, and even exacerbation of asthma.
So do we know why some people get hay fever and others don't?
So this is a tricky question. We don't have a clear answer to this. We know that there is a genetic predisposition to allergic conditions, but not in the sense that a mother has a peanut allergy and the kid will definitely have a peanut allergy.
Right.
But more that some families will have multiple family members with allergies like eczema and hay fever. And the theory is that there are some environmental triggers that cause these genetically susceptible people to start to display symptoms.
Right. Now, people typically will start using antihistamines. A common complaint is that the antihistamine works for a while and then it stops working. So what do you recommend people do, and why does that really happen?
So there is no real biologic reason for the antihistamine to stop working. So theoretically that shouldn't happen. So it's not so much that the medication is failing, but we actually need to think about what's happening with the condition.
Right.
It's possible that the condition is getting worse, so the disease is getting worse, or that it's persisted for so long and there is so much inflammation in the airways that it's become chronic and that there are long-term changes in the airways. And the antihistamine doesn't work that well anymore because it doesn't actually target all the inflammation there.
Right. And other than changing antihistamines, what's sort of the next step? I typically recommend nasal sprays. What do you sort of think?
So I usually recommend nasal sprays from the very beginning. Because nasal sprays, we know, are safe for long-term use in the vast majority of people. But the nasal sprays will also target the inflammation in the airways. If you're using a nasal corticosteroid spray, I would say be really careful not to pick a nasal decongestant because these can have long-term side effects, and because when you stop using them you can have more problems.
So you shouldn't use a nasal decongestant for too long?
Definitely.
How long is too long?
So sometimes when people are very inflamed, I sometimes say use a decongestant for up to 3, maybe 5 days to sort of clear up the airways a little bit to let the nasal steroid penetrate a bit better. After that though, we do start to see some rebound symptoms in people.
And with nasal steroid sprays, how long can people use that?
Basically as long as you need to. So the studies show that these medications are really safe. They do interact with some medications in certain people, but that's pretty rare. Okay.
Now, if antihistamines are failing, nasal corticosteroids are failing, we send our patients across to you, an immunologist. What else can be done?
So what immunologists can do is allergy skin testing to determine exactly which things in the environment are causing the allergic symptoms. And this is useful because then we can provide advice on what to avoid and what to do in certain seasons. And an immunologist can also help to interpret the test for each individual patient scenario. What can also be done is something called allergen immunotherapy, which is a treatment that aims to change the immune response so that it's more of a protective response rather than an allergic response. So this is also known as desensitization.
And how successful is that generally?
It's pretty good, but each individual patient needs to be considered. So we do get fairly good responses for patients who aren't allergic to too many things on the panel. There are certain allergens that respond better to this treatment than others.
Okay, That's really great. Thanks a lot, Jessie.
Thanks for having me.